It is fall 2025. It is open enrollment for 2026. Welcome to UC Retiree Medical Plans. My name is Garen Solbach. I'm one of the two healthcare facilitators at UC Davis. Nick Robledo and I are the two people at UC Davis who specialize in troubleshooting the use of UC health plans and coordinating them with Medicare for employees and retirees. We troubleshoot the plans so we know them well. I'm going to try to share some of the things that we've learned about the plans over the years and point out where anything might be different for 2026 as we go through today's presentation. Let's talk about what we're going to talk about. First of all, we're going to get into all the medical plan options that you have as a UC retiree. Then we'll talk about how to make changes to those plans. Then we'll have a section on Medicare and how it coordinates with UC health plans, and we'll talk about UC's Medicare rules. Anytime you see red throughout this presentation, red means Medicare. So if you see the color red, we're not talking about non-Medicare plans, we're talking about Medicare or Medicare plans. Then we're going to get into the individual plans themselves. We'll break down the HMOs and the PPOs by medical, pharmacy benefits, behavioral health benefits, and anytime you see anything in this light blue color, that is to alert you to a change for 2026. Then we'll get into a little conclusion, and hopefully you'll be better prepared for this open enrollment. Let's talk about the medical plan options you have as UC retirees. UCOP is shaking things up next year. There will be one fewer PPO next year. They are consolidating two PPOs into one PPO for next year, with more details to come. UC offers a menu of medical plan options, HMO plans, PPO plans. We're going to get into what those acronyms stand for in different parts of this presentation. But for now, I want you to focus on the fact that PPO plans generally work everywhere, whereas HMO plans do not. They are very geographically limited due to their model. So understand that HMOs are not available outside urban California. In fact, HMOs are only available in half of the counties in California, and UC doesn't offer any HMOs outside California, with one rare exception starting next year for UCOP employees stationed in Washington, D.C. So HMOs are essentially urban California only. But if you're trying to figure out where those plans might be available exactly in California, I can tell you that you won't find HMOs in the foothills or the High Sierra. You won't find HMOs north of, say, Santa Rosa or Woodland or Roseville. You can't even have an HMO in Chico. If you've moved there to be near the Sierra Nevada Brewery, you'll have to have a PPO plan in Chico, for example. But for detail, if you want to know exactly where the HMOs are available or not, use the UC Medical Plan Availability Tool. It's an Excel spreadsheet on the UC Davis Healthcare Facilitator Program website. That medical plan availability tool looks like this. It is an Excel spreadsheet, and you'll need Excel or an Excel viewer to use it, but assuming you can enter a zip code and choose an overlapping county to determine whether a plan is available. I mean, if you enter 95617 UC Davis Medical Center, Sacramento, California, Sacramento County, you're going to find all the plans. You're going to find all the plans in Davis, etc. But if you get to more remote areas, you might find that some of the plans aren't available. For example, shown here is zip code 95076 for Monterey County. HealthNet, there are no HealthNet plans in Monterey County, but there is Kaiser, not Kaiser Senior Advantage, the Medicare version of Kaiser, but you can see that Kaiser, the non-Medicare version, is available in that zip code in Monterey County. So there's an example of how you can use that tool to determine what plans are available where. Now, most people's priority is access to their doctor. They care less about which medical plan they have and more about whether they can get to their provider. So we've created a cheat sheet that you can find on the Healthcare Facilitator Program website, where you found the launch to this YouTube video. It's document called More on UC Medical Plans. Now, don't say that too fast. There's an HMO side and a PPO side to this document. On the HMO side, you'll see that it's easy to tell what medical groups are available through the HMOs. And you'll notice that North Bay and Sutter groups are not available in HMOs through HMOs using this document. If you want Sutter or North Bay, you're going to have to turn to the PPO side of the document, and you'll find that they are preferred providers. So this is an easy way to understand what's available in the Davis-Sacramento area. But if you need to look for individual practitioners, or you need to find doctors in rural areas or throughout California, throughout the United States, and anywhere in the world, I suggest you start with hr.ucdavis.edu/HCF#search. This will take you to a part of our website with jump-offs for provider searches for any of the medical plans in and out of the country that you might need to use. So I suggest you start there to find your providers. And here we have the HMOs and PPOs offered by UC. On your left, we have the HMOs, Kaiser and Kaiser Senior Advantage. Remember, red means Medicare. And the HealthNet plan, UC Blue and Gold HMO. On the right, in the PPO column, you're going to notice that Core and the UC Health Savings Plan have been eliminated. They are being replaced by a new PPO called Health Savings Plus. And Health Savings Plus joins UC Care as non-Medicare PPO options next year. Health Savings Plus and UC Care will be through Blue Shield next year, while UC High Option, UC Medicare PPO, and UC Medicare PPO with prescription drugs will remain through Anthem Blue Cross. The last of the Medicare PPOs, UC Medicare Choice, is through United Healthcare. That's the menu. How much all these medical plans will cost you per month next year can be found in your open enrollment booklet, which looks like this, if you get 100% of the UC contribution towards retiree medical and dental coverage. People who retired with 100%, they don't have to do any special calculations to see their rates. They can just look in the booklet. But if you retired with too few years to get 100% of the UC contribution, if you are subject to what we call graduated eligibility, where you get a percentage below 100%, then it's a little trickier for you to calculate your rates. Of course, during open enrollment, you can sign into the UC Raise system, click on Open Enrollment, and see your rates. But that only works during open enrollment. Or, year round, you might want to be able to know what the rates are. You can use the UC Retiree Premium Estimator, which is an Excel spreadsheet on the UC Davis Healthcare Facilitator program site. It will calculate how much you'll pay for medical and dental premiums, regardless of what percentage of the UC contribution you get. It'll also help you understand what you're eligible for if you aren't sure. Another way to calculate your rates is to go to UCNet. Here's a shortcut to the UCNet Open Enrollment website. It's ucal.us/OE, and you can use the premium estimator on UCNet without having to use Microsoft Excel or an Excel viewer. The tool does not compare the plan rates side by side, but you can at least find the individual plans premiums that you might need. The advantage of the Excel spreadsheet is that there's a tab that compares all the plans side by side for the big picture. Now, let's say you don't know what percent of the UC contribution you retired with. If you get 100%, this isn't a big deal. But if you get less than 100% and you can't quite remember what that percentage is, take a look at your envelope. The open enrollment booklets were mailed to people October 23rd, I believe it was. And if you take a look at the address stamp on the envelope that your open enrollment packet came in, there should be a number above your name. Here's an example name for Ima Retiree. Ima lives at 1 Shields Avenue, Davis, California. Right above her name and address, you'll see that Ima is eligible for 85% of the UC contribution. So if you're not sure reference your envelope. We have more to discuss about medical plan premiums. Not just UC medical plan premiums, but Medicare premiums if you or any covered family members are eligible for Medicare. So first of all, I want to make it clear that if you have a medical plan premium that you have to pay, it should be deducted from your UC pension check. If your UC pension check cannot cover the premium because it's too small, then you would have to do direct pay with the RASC and they would bill you. So make sure to keep your premiums up. But for most of the retirees, you'll just see your UC premium deducted from your UC pension. But reading that deduction on your UC pension direct deposit statement can be tricky. So let me try to translate some things into English. The amount that you pay, if you're paying anything, will appear as Med MBR Prem. Med means medical. MBR means member or retiree or you. Prem means premium. So if you see Med Member Premium, that means the medical plan premium that you are paying, the amount that UC pays appears as Med ER Prem. ER stands for employer in this case, not emergency room. Employer. And the employer is, of course, UC. So what you pay is MBR. What UC pays is ER if you see any premiums notated on your direct deposit statements. This is true for medical as well as dental. Now, let's say you do have Medicare. UC has no way to pay your Medicare premiums. Those are between you and Social Security. Now, most people, they have their Medicare premiums paid directly out of their Social Security income. It's just automatically deducted, easy peasy. But if you're somebody who's enrolled in Medicare, but you're holding out for a later age to claim that Social Security income, then they have nothing to deduct from. So you'll need to pay your medical plan Medicare premiums through either Easy Pay, which is an automated electronic payment system. If you Google Medicare Easy Pay, then you'll find instructions on Medicare.gov. Or you can pay manually electronically using mymedicare.gov. If you don't set up Easy Pay, then they're going to bill you quarterly, and I want you to pay those Medicare premiums electronically. Please do not put paper checks in the mail where they could be lost or stolen, because it's happened before. People's Medicare premiums have not been paid. Their Medicare gets canceled. It's a nightmare, trust me. So please pay your Medicare premiums electronically, ideally through Easy Pay or mymedicare.gov if you are not getting Social Security income. Now, if you happen to choose a Medicare plan through UC that costs so little that it costs less than what UC is willing to pay, if there's any money left over after UC pays a premium, then UC will add it to your pension check as a credit to partially reimburse you for what you pay for Medicare. UC requires you to pay for Medicare if you're retired. So if there's any money left over, we're going to add it to your pension check to partially reimburse you for those Medicare premiums. But keep in mind, Part B reimbursement is only available to those in the least costly plans. And that means either Kaiser or a very special plan called the UC Medicare PPO without prescription drugs. That plan is a very special plan for people who are triple covered. More on that later. But just understand, you're not going to get Medicare Part B reimbursement unless you have Medicare and unless you are in a very inexpensive plan like Kaiser or the UC Medicare PPO plan without prescription drugs. I want you to know some general things about UC medical plans before we get into more detail. For example, preventive care is generally provided at no cost by our medical plans. And by preventive care, I mean generally things suggested by the U.S. Preventive Services Task Force. Things like preventive physical exams and immunizations and colonoscopies and mammograms and such. But I like to say it this way. Perfectly healthy people get preventive care covered at 100%. And the reason I say it that way is that if a preventive service finds something wrong with you, then there may be a cost to you, and you can't be surprised by that. The idea here is that we want to lower barriers to getting preventive care so that we can catch things early that might be a problem, so that we can, so they can be taken care of more efficiently, have less chance of doing you even more harm. But don't be surprised if you are charged something if they diagnose you with a disease when you're getting preventive care. Something else I want you to know is that it shouldn't surprise you when there are slightly different benefits or vendors between medical and mental health and pharmacy and acupuncture and chiropractic. Different insurance companies will break up coverage in different ways because different parts of insurance companies may specialize in different things. Like pharmacy benefit managers specialize in pharmacy, for example. So expect that. I mean, you may have chosen a medical plan, but there may be several vendors that you will be using within that medical plan. Something else to be aware of is family member eligibility verification. UC is not going to ask you for a marriage certificate or a birth certificate when you add a new baby or a new spouse. Not right, UC doesn't ask directly. Instead, we use a third-party vendor called Unify HR to verify the eligibility of the family members that you're covering. So if you get married and you add a new spouse, don't be surprised when 2 or 3 months later you get a mailing from Unify HR. It will be co-branded with University of California logos, but the point is Unify HR might ask for marriage certificates, tax documents, or other proof that your dependent is still a legitimate dependent. UC pays Unify HR to do this because we've had way too many people fail to disenroll their ex-spouse or the grandchild that no longer lives with them or whatever it is. So every few years or so, you might be asked to verify your family members. And if you see anything in the mail from Unify HR, you need to take it very seriously, because if you fail to document your family members, they get disenrolled. It's kind of a big deal. Now, regardless of what you hear me say in this presentation or you see on these slides, you need to understand that the ultimate information is from your medical plan's plan booklet. That's the plan's Bible. The plan booklets, also known as evidence of coverage documents, or you might see them even described as summary plan descriptions, should all be available on UCNet. And here's a shortcut to the UCNet link, ucal.us/OE. I should say that's a shortcut to the UCNet Open Enrollment link. But year-round, you're going to find links to the plan booklets and other useful information on the UC Davis Healthcare Facilitator Program site if you click on the link in the menu that says the fine print. The fine print, where to find health insurance coverage details. There we link to all the plan booklets and other information that can be useful. Now, one of the reasons that the plan booklets are so important is that they tell you what's covered. They tell you how much you pay for things that are covered. Often it's important to know what's not covered, and that would be documented in the exclusions and limitations section of these plan booklets. You can also find out how to use the plan, how to file grievances, how to file appeals, I should say, etc. So the plan booklets are very important. And if you ever download these things and try to use them, I suggest you use the Control F. They're usually PDF documents. Hit Control F and then you can search for keywords to zone in on some of the more detailed information that you might be looking for, because the documents tend to be rather large. More general information about the plans, and I've got to call out the difference between the non-Medicare plans and the Medicare plans here. Weight loss, prescription drug coverage. There are changes to that coverage occurring next year for our non-Medicare plans. Weight loss medications like GLP-1s, like Wegovy or whatever, those are going to be limited to people with morbid obesity. That is, people with a body mass index of 40 or greater. There are exceptions for those who are continuing a course of treatment, but if you're starting up new treatment, you're going to have morbid obesity unless you have some kind of comorbidity. Now, UC medical plans will continue to cover these kinds of medications for people with comorbidities like diabetes, type 2 diabetes. Don't get me wrong, these drugs can still be covered even if you are not morbidly obese. But if you don't have a comorbidity, you're going to have to be morbidly obese to get those covered. And in case you haven't been aware of this, we discovered in the last couple of years that Medicare and UC medical plans do not cover medications solely for the purpose of weight loss. So again, you're going to have some sort of other diagnosis like type 2 diabetes to get some of those weight loss medications like GLP-1s. Now let's spend a little time getting to know when you can make changes and how you can make changes to your UC health plans, because open enrollment is not your only opportunity. Of course, open enrollment is your annual opportunity to make any changes to your health plans, and UC's open enrollment is generally the last Thursday of October, ending the Friday before Thanksgiving. It's usually a 3-week period. This year, open enrollment will be from October 30th to November 21st at 5 p.m., not midnight. Anytime you make an open enrollment change, that change is going to be effective the first of the following year. But open enrollment isn't the only opportunity to make changes. You can also make changes if you move outside your plan's service area. We discussed how HMOs are only available in urban California. Let's say you decide to move to Chico, California to be near the Sierra Nevada Brewery from Sacramento or Davis, and you're in an HMO. Well, you're going to have to change medical plans because HMOs don't exist in rural areas. Chico is just too rural. So if you need assistance with that kind of a change during the year, reach out to me, reach out to Nick Robledo. We help retirees make changes to their health plans when they have opportunities all year long. Another opportunity to change medical plans is if you enroll a newly eligible family member. So this means that if you're truly desperate to change medical plans and you don't want to wait till open enrollment, you might consider marriage or adoption. Another opportunity would be if you were to lose other coverage. Let's say you've opted out of UC coverage, you've suspended your UC coverage because you get a better deal by being covered through your spouse, but then your spouse retires or gets laid off and you lose that coverage. If you experience an involuntary loss of other coverage, what we call an ILOC, you can sign up for health coverage through UC mid-year without waiting for open enrollment if you can prove that loss with a letter from the employer documenting who's losing what and when. So if you lose other coverage and you need to pick up our coverage, let us know. Try to get things done in advance if you can. But technically, you have 31 calendar days as of the day you move outside a planned service area, or add a new family member, or lose other coverage to enroll through UC. But again, do things in advance, not after the fact. By the way, I almost forgot to mention it. Regarding moving outside the planned service area, if you are outside the service area of an HMO for at least 2 months, if it's going to be more than 2 months, I should say, you do need to change to health insurance. HMOs are prepaid medical plans where geography is destiny. If you are not going to be in that geography, if you're going to be outside that service area for more than 2 months, you need to change plans to something that will cover you where you're going. Then when you return, you could switch back to your original HMO if you want, or you could remain with your health insurance plan if you want. So again, let us know if you need assistance with any of these things. Something else to know, and something that's really nice about UC medical plans, when you're making these changes, you do not need to worry about pre-existing conditions exclusions in any of our medical plan contracts. Now, you may have friends that don't qualify for UC insurance who might try to switch from a Medicare Advantage plan, for example, to a Medigap plan, and then they have all these problems with pre-existing conditions exclusions because they've had a past bout with cancer or something like that, and their Medigap plan won't accept them or charges them high risk premiums, you don't have to deal with any of that stuff as long as you're covered by UC medical plans because you live in California and you have our custom plans. We have different benefits for Medicare retirees outside California. But in California, our Medicare plans, our regular non-Medicare medical plans, no pre-existing conditions exclusions, so you don't need to worry about your health as you make these changes. Let's talk a little bit about how to request an open enrollment change. Obviously, you need to make that request during open enrollment, so restrain yourself. Wait until at least 8 a.m. on October 30th to make your request. But the way you're going to make the request is by signing into the UC Raise Retiree portal. UC Raise stands for University of California Retirement at Your Service. That's the portal where you see your direct deposit statements, where you can change your address, where you can send secure messages to the RASC, etc. So you can sign into UC Raise, click on Open Enrollment, and make your requests. Another way to get there is to go to the UCNet Open Enrollment website. A shortcut to that is ucal.us/OE. Now, when you make your request, be sure to review your confirmation statement in your UC Raise messages. If you don't have a confirmation statement, you didn't make a change. You were just shopping, but you didn't make a purchase, if you will. So make sure you have a confirmation statement in those UC Raise messages. Now, what if you don't have online access or you've locked yourself out of UC Raise? Well, you can actually request open enrollment changes during open enrollment, of course, by calling the RASC, the Retirement Administration Service Center, at 800-888-UCOP. And they can make changes for you, and they can help you get into the website if you've locked yourself out. Now, if you or any covered family members are eligible for Medicare, you need to understand that there is additional paperwork that is likely to be required if you make a change between plans during open enrollment. Step 1 is to request the change through UC Raise. Step 2 is to attach a copy of your Medicare card to a form. If you need assistance with those Medicare coordination forms, Nick Robledo and I help people with those all the time. Give us a call. We'll make sure you know what you need to do. But you need to get that form in by November 29th. The RASC Retiree Insurance Unit wants those forms in by November 29th so that they have enough time to get them processed in time to make your coverage happen for January 1st. Now, let's say you don't want to make any open enrollment changes. What I tell people every year is that you don't have to do anything during open enrollment to keep your same plan because your plan will automatically continue. Or if you're in CORE or the UC Health Savings Plan, your plan will be automatically substituted with the Health Savings Plus plan. But you don't have to do anything unless you want to request a change. But this year, the premiums are all over the place. Some people are going to pay a lot less. Some people are going to pay a lot more depending on what plan you're in. So I'm going to say it this way this year. If you like what you have, do nothing but read your open enrollment booklet just in case there are any changes you care about, and compare your 2026 rates with what you pay now. Because like I said, there are going to be some big jumps in premium for some people, and I don't want that to be a surprise. Next, we'll talk a little bit about Medicare.